one sentence on conjunctival lymphedema. And what you are looking at are lymphatics which are not supposed to exist. And if there is some pigment at the limbus, you will see this lymphatic network beautifully. Professor Mahmoud of Switzerland, chairman, president of International Council of Homocysteine, says that it's amazing that all the ophthalmologists of the world did not see them. My presentations have been plenty and it has been published in a book also. And you can see the channels from the cornea going towards the conjunctiva, and you see all the rivulets being drained away. You have the mystery of both calycid for the last 100 years. And these are nothing but lymphatics. When you do optical section, you will find that they are tubes. And these calycids are connected to the cornea. There is a network of channels in the cornea also. And these calycids are connected to the conjunctival lymphatics. And in between cornea and conjunctiva, you have lucid interval in the cornea, which is also a channel. When there is severe subconjunctival hemorrhage, the lymphatics going towards the limbus to get filled up with blood. And my work started in 1999 by a chance observation. I injected lignocaine at 11 o'clock and instantly a lymphatic vessel rises at 2 o'clock. Then I injected triple tube and was able to find the network of lymphatics. And since then I have been hunting and shooting lymphatics. And in the operation theatre, if you twist the conjunctiva along the limbus, you will always see lymphatics running parallel to each other. And you can also see lymphatics by injecting triple tube at the limbus. It should work. Yes, it starts. So I've charted in dozens of patients, and this was my first one. And you can see that an injection at the limbus will chart all the conjunctival vessels of the in the neighborhood. And this patient had trauma and dislocated lens and glaucoma. I did microtransplantation before removing the lens. The next day, I injected triple tube into the anterior chamber. And you find that the dye passes through the filtration tract and outlines the lymphatics under the conjunctiva. And this patient had damaged conjunctiva along the limbus in case of vitreoretinal surgery. And I injected dye into the sclera, and it rose a number of knobs along the limbus because there were no vessels over there. And the surprising thing was that where the conjunctiva was normal, the lymphatics received the dye from the sclera. That means there is a connection between scleral vessels and the conjunctival vessels. And they all exist from the cornea as single channels, then they join with each other and then join with the conjunctiva. Sometimes they look like mushroom, depending upon the angle at which they issue from the sclera. And you see that they are in multiple layers. It's not just one layer, multiple layers. And so there are multiple layers of channels in the cornea, and intermediate there is the lucid interval, I will show you later. And they come out in multiple layers and join together into a multiple layered conjunctival lymphatic system. And after surgery, glaucoma surgery, if there is a failure and you try to mark out the lymphatics, you will fail to do that. That's why you try to look for a virgin area for doing filtration surgery. In this patient, because of multiple surgery, most of the conjunctiva was scarred. So I find one area where there is no scarring, and I do a simple operation. I just push the conjunctiva towards the limbus and use a fucoplasma plate and make 2 tracks into the area containing the aqueous. And doing that, I do not injure the lymphatics of the conjunctiva. Here's the other one. This is my latest technique, that I make a vertical incision in the cornea and use phaco blade to make a track from ab interno. The 300 micron tip just goes through the limbus and opens under the conjunctiva. So there is no damage to the drainage system of the conjunctiva. This is all the operation. It takes about 3 minutes to do. So now we have a closer look at the limbal area. You see these channels in the cornea, and you have that area of the lucid interval. And this is the lucid interval. Sometimes you get such beautiful pictures. You find that the lucid interval is not like a line. It is so irregular because of the channels which are connecting from the cornea side and from the conjunctival side. This was a patient with megalocornea and cataracts. We did cataract surgery and found an opacity in the center, and we magnified it, and we found that there was a network of channels in the cornea. And on optical section, these channels are found inside the stroma. And then if you look at patients with prominent arcocinalis, an older patient, you will always find these channels which you call as crocodile shagreen, which has no meaning at all. These are channels, and that's why they are there. As another patient, she has channels all over the cornea. And this one is after cataract surgery, very severe keratitis. And you would say that these are folds in the descemet membrane. That is not true. These are the channels which are draining the excess fluid in the cornea, and these are the stromal channels. And then there must be a final channel which you will find in non-specific keratitis. These are the micro channels. And you look at any optical section, histology section of cornea, and you will always find these channels in the cornea, and they are always labeled as artifacts, just because they do not know that lymphatics exist. Now these cornea surgeons, they take a big corneal bubble and lift the cornea, and this lifting is possible just because there are channels in the cornea, and you push air into the corneal channels, and they get lifted because the descemet membrane doesn't have any channel. So you cannot balloon something which is solid. Air and gas. And when you inject the air, you make a big bubble and look at the periphery. You will always find that the lucid interval contains that air. Now this is a very interesting case, very, very prominent lucid interval, very prominent arcocinalis. And when I go closer, I find that the edge of the arcocinalis looks rough, and when I magnify it further and find that these are the channels from the cornea into the lucid interval, and they are there in multiple layers. At our optical section, the lucid interval will appear as a triangle with the anterior and the posterior wall, and you will find it is connected to channels towards the center of the cornea. The first time I saw dye that was long time back, I injected dye into the cornea to mark the conjunctival channels, but I found dye in this area, which is the lucid interval. I have been able to pass 100 micron blunt wire into the lucid interval a number of times, so I don't need to do again and again. But a wire cannot pass into the channel, into an area which is not a channel. And I can pass a 230 micron cannula into the lucid interval. And this you have already seen. Now what I am going to show is that when you inject dye in the lucid interval, this dye moves preferentially towards the center of the cornea. That means this could be a source of nutrition for the cornea and not merely the endothelium. And maybe this is the major source of nutrition. On optical section, I sometimes find that the lucid interval area is connected to canal of Schlemm area through aqueducts. And this is happening all over. It's not uniform, and you do not see it every day, but you see it frequently. Now, if you use pilocarpine, sometimes you find that on the optical section, one area of the lucid interval becomes more prominent. And this is a very, very prominent case. Had an angle closure glaucoma, I gave pilocarpine, and 24 hours later you find that the lucid interval is prominent and the aqueducts are prominent and they are connected to canal of Schlemm. So this is the picture that you have the lucid interval as a central artery which is collecting fluid from Schlemm's canal, and it is pushing fluid into the cornea and pushing fluid into the conjunctival lymphatics. Our corneas are highly reactive, all because of lymphatics. Here is a small corneal abscess and you find so many cells in the cornea, and on optical section the cornea is full of cells. Just 2 days later, under intensive treatment, you find that the cells have disappeared and channels have appeared. Channels determine disease pattern. So you will find in many infections, especially fungal infection, radial spread, circular spread, and spread like satellites. And all these changes are occurring in the middle of the stroma. And network-like spread you often find in fungal infection, just like that. And channels solve many mysteries. For example, this is a case with oblique hypopion, very strange. And under intense treatment, next day you find that the hypopion has shifted vertically and it has gone within 24 hours, it has reached 12 o'clock position. That means the infection is passing through. And you see this very fast spread. The fast spread will occur only because of the presence of channels. Corneal nutrition comes mainly from the periphery. Once you have a ring abscess and a ring ulcer, the nutrition of the center part of the cornea suffers and nothing can save it. That means periphery is more important for nutrition than just endothelium. Channels help in diagnosis and treatment. This is a young patient who came with infiltrates in the area of lucid interval. I look at 6 o'clock, there are satellites, and on 3 o'clock you see number of satellites going upwards to 12 o'clock. So prognosis grave, reduction was needed. So this is what I did. I opened whole of the lucid interval, injected antifungal, antibacterial into the lucid interval, injected antifungal, antibacterial into the cornea, and then this is the final result. She recovered. Then there was a patient who had been under treatment often on for 6 months elsewhere and he would not heal. I looked at the ulcer and saw that the lucid interval was infected. Now unless you treat lucid interval, this ulcer is not going to heal. So this is what I did. I opened the lucid interval and treated and he soon recovered. In acute glaucoma, why there is edema? It is because the fluid is pushed from Schlemm's canal via the connecting this whatever it is into the cornea, and the cornea becomes edematous. The moment you do filtration, the cornea becomes clear. You see this. In the case of acute glaucoma, I am doing transciliary filtration into the posterior chamber. At the moment the fluid starts coming out of the channel, the cornea becomes clear. Just like that. So this would not happen if endothelium was responsible for the control of fluid from the anterior chamber into the cornea. So it is the movement, mass movement from all over, from the Schlemm's canal into the lucid interval canal into the cornea, that causes edema, and once you reduce the pressure, immediately the fluid moves out. Okay, and the limbal allergies are connected with lymphatics. You see them every day. So all I want to say is that the corneal channel, the lucid interval, the sclerojugal channels, conjunctival lymphatics, they are all one system and need to be studied like that. Thank you very much.